Ethics, Boundaries, Laws, Regulations. MBLEX Exam Question and Answer. Question 1. What do boundaries clarify? A. Our needs and desires. B. Our need to protect ourselves. C. Our need to protect our clients. D. Our personal limits and expectations. The right answer is our personal limits and expectations. Explanation: having clear boundaries will assist the therapist in knowing when a personal limit has been reached and what can be expected from the therapist and the client within a professional relationship. Question 2. A massage therapist that conducts a regular self-assessment of strengths and weaknesses, respects the privacy of client information and upholds the standards of professionalism is adhering to A. The massage code of ethics. B. Legal boundaries. C. Informed consent. D. Personal boundaries. The right answer is the massage code of ethics. Explanation: the massage code of ethics is a standard of conduct that defines ethical behavior for a massage therapist. The question lists principles of the massage code of ethics. Question 3. A massage therapist has created a beautiful and comfortable space for treatment. They have posted their rates in clear view on the wall and created a well-thought-out intake form. They are extra careful to be aware of informed consent and client disclosure, as well as following all state and federal laws for running a massage practice. Which of the following best describes the guidance a massage therapist follows for establishing their practice? A. Confidentiality. B. Personal boundaries. C. Professional boundaries. D. Framework. The right answer is framework. Explanation: the question describes the fundamentals of framework. A framework is all-encompassing within the massage field and includes the values and visions, conception, design and desires of a massage therapist as they apply to a business model. Developing a solid framework is essential to creating a healthy and successful practice. Question 4. Is the knowledge base and practice parameters of the massage profession? A. Scope of practice. B. Code of ethics. C. Frameworks. D. Standards of practice. The right answer is scope of practice. Explanation: the knowledge base refers to education and special training, skills for providing care. The practice parameters refer to conduct and environment. These two combined explain the basic concept of the scope of practice. Question 5. When are massage therapists allowed to disclose confidential information about the client to third parties without the client and number 8217's consent? A. When the massage therapist is placed in danger. B. When required by law or court order. C. When the massage therapist has suspicion of child abuse. D. All of the above. The right answer is all of the above. Explanation: in almost all situations, the massage therapist needs to retain a strict confidentiality of the client and number 8217's information. However, there are certain exceptions, such as when the massage therapist feels in personal danger, when there are suspicions of a client abusing a child, and whenever required by law. Question 6. Having a discussion with a client about the positive and potentially negative effects of massage for a certain condition is an example of A. Framework. B. Ethics. C. Informed consent. D. Personal boundaries. The right answer is informed consent. Explanation: disclosing all of the details about a treatment to a client gives them the opportunity to decide how to proceed and is part of the process to obtain informed consent. Question 7. When a client asks for personal information about their friend which happens to be a client, the correct response should be A. To discuss the details. B. To end the conversation. C. To find a way to turn the focus back on them. D. To tell them some but not all details. The right answer is to find a way to turn the focus back on them. Explanation: when a client asks about the private matters of a common client, friend, they are trying to fill a gap that a massage therapist, as a professional, should not fill. The massage therapist may think the client making the request for information will respect the therapist for divulging privileged information, but they will ultimately grow to distrust the therapist and number 8217's adherence to client confidentiality. The best answer is one that puts the focus back on them. Question 8. There are moments when a massage therapist needs to disclose personal information about themselves to clients. Which of the following is considered an appropriate disclosure? A. Sharing information about a mutual friend. B. Coming down with a cold. C. Relationship difficulties. D. Business concerns and financial woes. The right answer is coming down with a cold. Explanation: coming down with a cold directly affects the client within the therapeutic environment. The other three choices are irrelevant to a client. Question 9. On a unique occasion, a client appears depressed and mentions suicide as a possible option for dealing with life. Suggesting the client seek professional help is considered A. Professional obligation. B. A personal preference. C. Beyond the scope of practice. D. Inappropriate. The right answer is professional obligation. Explanation: one of the few times a massage therapist is allowed to break confidentiality is when he or she suspects a client to be in personal danger or harm. In this case, the massage therapist has a professional obligation to ensure the safety of the client. Question 10. Which of the following is a violation of client confidentiality? A. Maintaining records in a safe location outside of the office. B. Speaking with a client's doctor about their prescription. C. Approaching a client in a public setting. D. Asking a client about their home office. The right answer is approaching a client in a public setting. Explanation: although it may seem cold and unfriendly, it is up to the client to approach the massage therapist if they wish in a public setting. Question 11. Throughout the years, a massage therapist can learn a multitude of disciplines which can be used during treatments. A massage therapist who works with pregnant mothers, athletes and repetitive stress injuries is best described as using A. Integrated approaches. B. Massage fundamentals. C. Structural integration. D. Applied kinesiology. The right answer is integrated approaches. Explanation: a massage therapist who can utilize a broad range of skills to treat various unrelated conditions is known to employ integrated approaches. Question 12. A regular client who has been going through a divorce has begun to share emotional details about their experience. They are staying later after their treatment and now routinely show up late for their appointment. They state they are having a difficult time and really need a friend. What can be said about the relationship between the client and therapist? A. Developing a friendship with the client. B. The client is testing the boundaries of the therapeutic relationship. C. The client is still learning how to be responsible. D. Everything is okay. The client will eventually recover. The right answer is the client is testing the boundaries of the therapeutic relationship. Explanation: a client who routinely presses the structure of the practice, like in this case, is testing the boundaries on what is acceptable. Regardless of a client and number 8217's situation, it is the therapist and number 8217's responsibility to set appropriate boundaries to ensure all participants feel safe and comfortable within the therapeutic environment. Question 13. Your last client of the day asks to treat you to a few drinks. What is the correct response? A. Suggest another time. B. Say yes as long as it is not too expensive. C. End your professional relationship with them. D. Decline the invitation in order to keep the relationship professional. The right answer is the well-being of the client. Explanation: the concern with fraternizing with clients outside of the therapeutic environment is to avoid the possibility of creating a dual relationship. Question 14. A client who often jokes about going out on a date is A. Developing a friendship with the therapist. B. Exploring the therapeutic relationship. C. Testing boundaries. The right answer is testing boundaries. Explanation: any client who routinely requests to explore beyond the professional environment is testing the boundaries and professionalism of the therapist. Remember, the therapist is always at fault for allowing a breach of professional boundaries. The repercussions can lead to a hefty fine and/or loss of a massage license. Question 15. A therapist may legally engage in sexual relations with a client if they A. Obtain written permission from a lawyer. B. Officially end the client-therapist relationship within a week before intercourse occurs. C. A therapist should never engage a client in intercourse. D. Maintained a sexual relationship prior to developing a client-therapist relationship. The right answer is maintained a sexual relationship prior to developing a client-therapist relationship. Explanation: there are laws, rules and regulations against developing a sexual relationship with a client. If a sexual relationship existed prior to the client-therapist relationship, then continued sexual interaction is allowable. A typically safe amount of time to wait is 6 months after the client-therapist relationship has been dissolved, documented and signed by both parties, before. Question 16. Which of the following best describes a massage therapist who routinely drapes clients in an immodest and unprofessional manner? A. The massage therapist needs additional training. B. The massage therapist has broken a code of ethics. C. The massage therapist is participating in a dual relationship. D. The massage therapist's scope of practice needs to be redefined. The right answer is the massage therapist has broken a code of ethics. Explanation: there are times when undripping sensitive areas for treatment is within the scope of practice of massage. However, a massage therapist who routinely drapes in an unprofessional manner is breaking a standard of conduct indicated in the massage code of ethics. Question 17. Over the past year, the relations between a massage therapist and a client has grown friendly. There are times when both parties talk during the massage session and sometimes things are shared that are beyond the regular scope of practice. Lately, the client, who openly talks about his financial success in business, has been having difficulties with the construction workers who are building the client and number 8217's dream home. The massage therapist, who lives in an apartment, has recently become irritated by the client and number 8217's personal problems and is having a difficult time performing her duties as a massage therapist. Which of the following best describes the relationship? A. A dual relationship. B. Transference. C. Countertransference. D. Indifference. The right answer is countertransference. Explanation: countertransference is when a practitioner projects feelings or emotions onto a client. In this case, the massage practitioner is most likely jealous of the client and number 8217's fortunes and has lost the ability to be a compassionate professional towards them. If this were a dual relationship, the two parties would be engaging each other outside of the treatment office. Question 18. Code of Ethics states that the professional should and number 8230 and number 8230 and number 8230 and number 8230 and number 8230. A. Discriminate against clients and/or health professionals. B. Provide treatment regardless of whether it is advantageous to the client. C. Have a sincere commitment to provide the highest quality of care to those who seek their professional services. D. Not allow the client to discontinue service if prior consent is given. The right answer is have a sincere commitment to provide the highest quality of care to those who seek their professional services. Question 19. Standards of practice, Standard V, Roles and Boundaries. The professional shall and number 8230 and number 8230 and number 8230. A. Not engage in sexual activity with a client. B. Allow transference and counter-transference for optimal boundaries. C. Continue to provide service to abusive clients. D. Encourage dual relationships as part of normal conduct. The right answer is not engage in sexual activity with a client. Question 20. Which of the following are functions of standards of practice? A. They inform new members of a professional group about the group's expectations. B. They inform members of the public about the responsibilities they can expect from the group. C. They inform other professionals about the standards of professionalism of the group. D. All of the above. The right answer is all of the above. Question 21. Regarding dual relationships, which of the following are true? A. Dual relationships happen when interactions between the therapist and client cross roles. B. Dual relationships are encouraged for making friends. C. Dual relationships are when the therapist and client maintain a professional relationship. D. None of the above. The right answer is dual relationships happen when interactions between the therapist and client cross roles. Question 22. Physical boundary violations and number 8230 and number 8230 and number 8230 and number 8230. A. Occur when someone enters another's personal space without being invited. B. Can happen if your client interprets your touch as sexual. C. Can include smells and aromas that your client finds offensive. D. All of the above. The right answer is the well-being of the client. Question 23. A self-employed sole proprietor or independent contractor, how often are you required to file Form 1040-S with the IRS? A. Monthly. B. Quarterly. C. Bi-yearly. D. Yearly. The right answer is quarterly. Explanation: Form 1040-S is required for estimated tax liability, especially if you expect to owe at least $1,000 in tax for the year. You are required to make estimated tax payments to avoid federal penalties. The practice of paying your quarterly estimated tax reduces the burden of paying a large sum all at once. Question 24. There are two main roles between a therapist and a client. The first role is as a massage therapist and the second role is as A. An instructor. B. A counselor. C. A professional. D. Friend. The right answer is a professional. Explanation: the second role, as a professional, is as important as the first role. One can be the greatest massage therapist in the world, but if the massage therapist does not abide by the guidelines, ethics and laws set forth for the profession, then the therapist can do more harm than good to those who seek their help. Question 25. Which of the following is not a warning sign of a boundary issue with a client? A. Changing the way you dress for a particular client. B. Spending more time with a particular client than any of your other clients. C. Talking about personal issues with your client. D. Greeting your client in the same manner that you greet all of your clients. The right answer is greeting your client in the same manner that you greet all of your clients. Question 26. What is the primary reason for keeping client records safe and protected? A. Personal reasons. B. To ensure you are paid from insurance. C. To protect against being sued. D. Client confidentiality. The right answer is client confidentiality. Explanation: client confidentiality is an aspect of professional ethics and should be adhered to out of respect for the client. Also, not protecting a client and number 8217(s) information is a violation of HIPAA. Question 27. Transference is and number 8230 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 and number 8230. A. When unresolved feelings and issues of the client are transferred to the therapist. B. Not a warning of boundary violations. C. Transferring a client to another location. D. Is when a client tells you that they changed their employment. The right answer is when unresolved feelings and issues of the client are transferred to the therapist. Explanation: occurs when the client transfers feelings, thoughts and behaviors related to a significant person in his or her life onto therapist. Question 28. Within the massage therapeutic relationship with a client, what is the primary focus? A. Developing a friendship with the client. B. Being the best massage therapist ever. C. The well-being of the client. D. Present a warm attitude. The right answer is the well-being of the client. Explanation: the goal within the therapeutic relationship is the health and well-being of the client. Question 29. A client states that you remind them of her mother. What is this is an example of? A. Countertransference. B. Transference. C. Transience. D. Warm attitude. The right answer is transference. Explanation: transference is a psychological phenomenon in which a person unconsciously redirects their feelings about one person onto another. Question 30. Underscore is a set of guiding moral principles that governs the individual and number 8217(s) course of action. A. Standards of practice. B. Code of ethics. C. Scope of practice. D. Intimacy. The right answer is Code of Ethics.